Hi, everybody. For those who don't know me, my name is Tev Kelman. I'm a Worker Center member, and I'm also a high school teacher at Randolph Union High School. And I'm sorry I couldn't be here tonight, but I Amy had reached out and asked if I could talk a little bit about kind of a school workers' perspective on how the healthcare crisis and the fight for universal healthcare connects to the school funding crisis that Vermont is facing right now. So I'm going to talk about that a little bit. Um, Vermont's education funding crisis, as you may already be aware, this past town meeting day, approximately one third of the school budgets statewide were voted down. And there are a lot of complex reasons for this, but one of the major drivers is that property taxes, which are kind of the main funding source for K 12 education, have gone up by almost 20% on average statewide over the past year. And there's a bunch of reasons for this. One of them has to do with this new law called Act 127, which was designed to correct some inequities in how the state calculated per pupil funding. I'll explain that a little bit more later. Um, Another thing is that the property values in the state have just been skyrocketing, largely due to kind of a boom in people wanting to move up to Vermont or buy a second home as a result of the pandemic. And this, of course, connects to the housing crisis and the shortage of affordable housing that we're seeing. Um, and then increased school costs are a major factor. There's something like $240 million of additional spending in schools for the upcoming budget year compared with last year. So I want to dig into that last one and why is that going on? And while this is still, very much kind of unfolding and we don't know exactly what will happen, one thing that's guaranteed to happen is layoffs in schools, which means reduced services and programming for students, which means more stress on the remaining staff and more students not getting what they need. And inevitably, this is going to strengthen the hand of folks who want to, privatize and close schools, kind of what I would call enemies of public education. So it's not good. And so to dig a little bit into what is driving these increasing school costs that we're seeing, one big thing is that during the pandemic, schools received a lot of money from the federal government through programs like ESSER to fund various programs, but especially positions and programs to support student mental and physical health, as well as supports for academics and behavioral supports and things that schools were needing extra staffing for during the pandemic. Now, a lot of the things that we're seeing with kids that have led to the need for that extra staffing have by no means gone away because of the profound impact of the pandemic on kids' mental health and their academic and social and emotional development, as well as really just extremely high rates of absenteeism that we're still seeing. And the economic effects of the pandemic on students' families, all of that stuff is still very much with us. So we're seeing increased student need, especially in the area of mental health. There's some really disturbing statistics that have been coming out of student mental health and wellness surveys that we do every year, just revealing like extremely high rates of depression and anxiety and suicidal ideation among our kids. So on the one hand, we're losing the funding to pay for these much needed programs, and that's being shifted onto districts' costs. It's becoming more expensive to educate kids because of capitalism, in a word. And then I mentioned earlier the Act 127, which is this new law that the legislature passed last year. And basically, what it does, it's extremely wonky, and I'm going to try to just give sort of the bare bones, but it basically changes the formula for how the state calculates per pupil spending, and it puts more weight on certain categories of students that are seen as more expensive to provide what they need, and this includes historically oppressed racial and ethnic groups, students in poverty, students living in extremely rural areas, English language learners, and some other categories of kids like that. And so schools that have higher percentages of students falling into those categories have gotten more funding as a result of Act 27, but communities, often wealthier communities that have lower percentages, are seeing especially increased property tax rates as a result of that. And then, of course, there's the effect of inflation, which we all know has been skyrocketing over the past couple of years. And the increased cost of living means that the salaries and benefits for school staff have also increased at a higher rate, right? Because we need to negotiate bigger salary increases in order to afford to keep up with the cost of living. So usually those salary and benefit costs go up by about 2 to 3% a year, but over this past year they went up by 6%. And that's significant because salary and benefits in general account for something like 2/3 or even a little more of the overall education spending, of the total education spending. So that 6% it is, yeah, a significant piece of the pie. So all that brings us to healthcare because we talked about how there's this 6% increase in salary and benefits, which is a large majority of the overall spending picture. And of that, healthcare costs account for, healthcare costs, which rose more than 16% this past year and which have been skyrocketing for like the past decade, as you can see in this graph. Um, well, that massive hike in healthcare costs is also a significant chunk of the increase in school spending. So we talked about how there were about 240 million extra dollars being spent on public education statewide this year. Well, 16% of that is driven by increased healthcare costs. That's about $42 million that, instead of going towards staffing or programs or facilities or something that would sort of directly benefit kids, is going directly to Blue Cross Blue Shield, the primary insurer for Vermont school workers. So in terms of what this means for the nonviolent Medicaid Army and the Vermont Workers Center strategy, I think this is a situation that really brings the links between the healthcare crisis and the education funding crisis into a really sharp focus, and that creates an opportunity to make the case for fully funding Act 48, not just as a solution to the healthcare crisis, but also as a key piece for equitable funding of our schools. Um, and really that starts with building a narrative among school workers and within local school districts, school boards, et cetera, that if we were to fully fund Act 48, that would take healthcare, this major chunk of what is driving up the cost of education, off of local districts' books and out of the property tax revenue stream. And that would provide relief to taxpayers, but it also free up resources for students and puts districts more in a position to offer the kind of compensation to school employees that they deserve and that is needed to attract and retain high quality people in our school system. And then there's this added benefit that ensuring universal access to healthcare would also relieve the burden that schools are facing in trying to serve students who have unmet healthcare needs, mental and physical, probably especially mental health needs, as well as their families who are struggling with some combination of lack of access to care and or not being able to afford the healthcare that they have, and sort of driving people into poverty. So historically, healthcare has not been a top issue for healthcare work, or I'm sorry, for school workers, at least not recently. But right now, it's having this really damaging downstream impact on the resources that are available, and that's leading to, like I said, layoffs and extra burdens and kids not getting what they need. So that might provide an opportunity to kind of change that narrative. Um, so there are definitely challenges and opportunities. In my experience, there's broad support among school workers for the principle of universal health care, but our union, Vermont NEA, has not been, for various reasons, a strong ally or an active participant in the fight for universal health care. Um, And I feel like that's a whole other conversation of what's going on there. But one thing that is, presents a potential opportunity is the fact that Vermont NEA, as well as VSEA, the state workers union, both negotiate their healthcare package with the state, probably every 3 years. And in the past, these have sometimes been contentious negotiations. But it seems significant because it provides a potential mechanism outside of the legislative process, to put demands for a universal publicly funded healthcare system on the state's plate, and even potentially to enforce them with some sort of statewide labor action. But that is not sort of the orientation of the unions right now, and it's probably particularly hard at this moment to build an appetite for that among school workers, given that the state and the unions just settled on a mutually agreeable healthcare package that's going to last until 2027. So right now, that sort of bargaining option is off the table. But nevertheless, I think that it's a time that we need to be trying to organize school workers, and I think particularly support staff, ESPs, custodians, school lunch program employees. All of these folks are much lower paid, and while they do get you know decent health care, through this contract with the state, I think those are the folks who are feeling the effects of the crunch the most, and are probably uh, most in line with the base of people we're trying to organize. Um, so I'm sorry if that was too long or too wonky. There's definitely like a lot of complexity to this issue, but I think the bottom line is we need to continue to find ways to broaden the message of who would benefit from and how they would benefit from funding Act 48. And I think this is a moment where people who are connected to the schools are particularly open potentially to our message. So thank you so much.